So I'm going to lead off with something that we discussed in the setup call, which is, so there's a tension here basically because you are, that was awesome basically. I mean, the stuff that we saw that you showed us was awesome. So there are two ways that I can actually process as, you know, the guy with a questionable sense of direction and a real reluctance to ask for directions. And that is, my God, you know, great things are still possible. I should go out and do something. But also a common reaction for people is, my God, those people are incredibly smart and talented, and I will never be able to do anything like what they do. So the first question lead off basically is, so what do you think was special about the circumstances that you looked at? And you can talk about Adventists if you want, Stuart. And what do you think was common to any place that these people are working? What's the generalizability or the scalability of the things that you've talked about for, you know, someone who feels, you know, pretty average? What do you think?
Well, let me try to answer that first. Yeah. You know, what I found looking at different hospital systems, and I also look at schools and housing institutions as well, is that, you know, you can get a lot of small things done that begin to sort of paint the picture of what the broader thing is needed. And I think that's very important in the sense, if you're trying to get big change in the way resources are allocated, for example, you've got to start by building a case and showing it. And so these issues are like as I mentioned about data, collecting, you know, some impact, you know, looking at say, what Tiffany's doing. So what's the effect of this? It's really important to start building up, because by doing that, it's sort of phase one of where you want to be. Then the next phases are talking to people in positions of authority, in terms of the government and so on, about how you would then start to kind of move things down the right channel. But the critical thing is to have the examples to look at and to be analyzed sufficiently well that you can demonstrate an effect to the next layer that has to make a decision. You've got to think of decision making as kind of layers, and each layer is more remote from the people actually doing things. So it's great to have both of these ladies here today to say what can happen on the ground. Yeah. Because often people who make decisions have literally no knowledge of that.
So basically, by doing the experiment on the ground, you actually start to inform people that can influence policy, or that can actually generalize the
and I think there's a very important role in communities for other institutions like universities and so on to start helping build the case for what goes on in a particular community setting. To provide, you know, pro bono, or through, you know, you have PhD students all over the place looking for subjects, right? Mm-hmm. How easy it would be to link some of them with what goes on the ground to build the kind of evidence that can then persuade next levels up. That's really important in terms of scaling up the kinds of activities that we've been talking about this morning.
Tiffany, that's the view from the top. What's the view from the grassroots?
You know, and I agree in many ways. But I first will say all of you all can do any of the items that we've talked about. It's about mindset. It's will and skill. Do you have the will, and then do you have the skill? And if you have the will and skill, a lot of this is about being purposeful and having the passion behind the work. So for us, and I completely agree with Stuart with certainly what he just shared. I shared the first two places that I looked at was the mission that has the homeless students and then the United Way. Well, the second two places were the universities. And I asked, can I meet with them? And they brought people around the table, and we talked about what are the unmet needs that they can meet. I mean, already KU, which is close to Topeka, they're offering free health exams for all of the students that need to come back and have their physicals done. I mean, that's just one small example. So we'll also be looking at social work and counseling. So, you know, looking at what resources do you have? And then you connecting the dots. If no one else does it, then you be the one to do it, no matter what your job description is. And so I think when you're thinking about, can I do this? The answer is absolutely yes. If you have the will to do it, and if you don't have all the skills, if you have the will to go find the people with the skills to do it and then start connecting the dots, it can certainly be done and replicated.
So, Amy, you've worked in a number of different places, you know, places with lots of resources, places with not many resources. You know, what are your thoughts about that? I mean, in some ways it can feel like this is a one-off. We have this situation, and we are respecting kind of local custom and culture and all those things. But to what degree could somebody take something that you did in Haiti or Liberia and import it into where they are?
I think, mic'd up.
Sorry.
To echo what Tiffany said, I think to me the will and the kind of ability to think creatively and outside of the box is even more important than the skills. And the skills, as you mentioned, you can learn, or you can find the people who have them who can help you. And I think one of the real things that I really appreciate about Mass, which differs in the other places that it worked, is not just the kind of context in which it works or the type of projects that it works on, but the mindset behind constantly trying to challenge the assumptions and the bounds of what architecture can do. I think in the beginning, we started kind of step by step in growing that idea. It began with this idea that architecture doesn't just need to be this kind of formal practice of nice, beautiful stuff for rich people, that it can directly impact people's lives. Then we grew that idea. We tried to show by example, and we tried to be able to start scaling some of our projects by kind of collecting best practices and integrating those into things like national policy so that they could be replicated. And then we began thinking beyond about what architects do, not just design and construction, but research and providing the evidence base to convince others why good design has value, and constantly trying to kind of challenge the role of what the practice can be. So I think that really it's just about being able to be part of a team that has a common expectation of being able to step back constantly and challenge what you're doing and why you're doing, and be able to think past your own projects to what you want to, where you want to be 10 years down the line.
So I hear a lot of kind of breaking through assumptions, I would guess, basically roles to find, that's not my job, that's social services, or that's, our job is basically just to build the structures. We're not about influencing the culture or the flow of things. But I'm reminded basically when talking to people out there, people who say, particularly in healthcare, where we say, well, gosh, we really need to enter into the community and start to work on these other social determinants. There were, the answer that comes back is, dudes, there were already people out there doing that. So, so you're actually entering into somebody else's space. And that feels to me to be, it could be a little bit dicey, a little bit dangerous. I mean, what kind of advice do you have for people who suddenly say, oh my God, I need a particular set of skills or a particular set of assets, basically, in order to be able to accomplish my goal? How do I enter somebody else's world in a way that they might actually want to work with me?
Maybe I'll start. Maybe we'll go this way this time.
Yeah.
So I think particularly as a young design professional, it's really easy to enter into somebody else's space and feel like, who am I to intervene in the current health system? Who am I to say that things can be done better or things can be done differently? And I think particularly when we began working with the Liberian Ministry of Health and with kind of big international aid organizations like USAID, et cetera, it was easy for me to feel like, wow, like I don't have very much expertise. I'm young, I'm new to this field. But I think the more that we began to be in the conversation and really to understand what was going on and what the needs were and what the opportunities were, it became increasingly apparent that I think we do have something to add. And sometimes fresh eyes and not being entrenched in the kind of expectations of what can or can't be done is actually a helpful handicap to have. And I think what I would say to your question is that you have to kind of talk the talk and believe that you have something to add, even if you don't have the experience to back it, and that you can gain that and kind of bring freshness and really leverage that to your benefit.
Tiffany, what do you think?
I guess for me, a lot of this is about understanding, and I mentioned understanding the story behind the behavior, so understanding where people are and then meeting them where they are. And I think the deeper understanding you have about the individuals that you're serving and or the community that you're serving, the more you're able to go into spaces and not have people feel like you are intruding in their space. Relationships are huge. So there are two pieces of that. So as an example, and I'm just going to give you practical stuff to just say, here's what it looks like. So on the relationship end, I was superintendent in Montgomery County. I was the first African-American and first female there. And so Shawsville, which is an area that doesn't have many African-Americans, really any, If I reach to shake your hand, I may hear the N word when I'm driving down in the Shawsville area, or I may see it written on my car or something like that. And so if I reach out to shake your hand, and because I'm African American, initially they might step back. Then I'd say, oh, well, I'm gonna give you a hug. Well, they put their hand out. How do you, creatively build relationships? People see from where they sit. It's not personal. And I say that, baby, it's not personal. You see from your life experiences. So there's nothing you can do that to me is really going to be insulting. And so you have to know that. So then that means that rather than feeling that I'm intruding, I'm trying to understand what you see from where you sit. So we actually embed social justice training in all the places I've been. I've been doing that since I became superintendent. It's the first workshop. In fact, in Topeka, the equity retreat will be next week at the Brown v. Board building, one of the retreats, which is where the landmark case that allowed for all of the schools to end segregation. And so this piece of that understanding, it's critical. The only other item I'd mention is this is a system issue. So some of you all came up and said, I have this program, or, how do I make this change? This isn't a program issue. Programs come and go with the leader. Come and go with the money, they come and go with the leader. Your focus needs to be on systems, systematic change, understanding the system. And Jennings, if you look at WashU, I think on YouTube, Washington University has our students there doing system design work with the School of Architecture and the School of Social Justice and Public Health, because we're teaching high school students how to think about systems and changing the system. That's how you have this mass effect.
Wow, Stuart?
It's one of the things you said triggered something in my mind. When I first came to the United States in 1979, and then started working on urban policy actually very early on in the 1980s. And at one time I live in Washington, and I was invited down to an area of Washington called Anacostia, or Kenilworth Parkside actually is the name of the area. So I come to this place. I'm the only white person in the room, right? And the person introducing me to them, to these people, said, we have a guest here today. He's not from here, and he has a funny accent, but he's good people. And that, you could see everybody's expression change. So this issue of how you, particularly if you're a hospital system, how you engage with the community is a very tricky issue.
You mean there's not immediate trust?
There's not immediate trust. There's a suspicion about sort of, well, why are they doing this? What's this got to do with the bottom line, and so forth. Right. And I think one of the things I've learned very much in this field is it's really important to start small.
Okay.
If you come in and say, we're the XYZ hospital, we're here to save you, right? Yeah. You're not going to go. Partnerships are the key. It's important to partner, not to push people out of the way and do it for them. Yeah. Partnerships are critical. Partnerships are based on trust, and trust is based on relationships. You have to build that relationship. I think if you start to do that and start absolutely small, aim to start small, because you're more likely to end up being able to make big change by starting small than trying to come in with all the resources at the beginning. That's when hardened walls develop. And that's kind of what I found. And I found, I've worked with a number of hospitals that have done this on a very small scale. And it takes time to build up that relationship and that trust.
Why do you think that is? Because in some ways that's kind of counterintuitive, right? You say, I'm the hospital, I'm going to bring many dollars here to this community in order to be able to fix it. Why do you think that people kind of go, the hell
Because people think there's never something for nothing, that there's going to be a quid pro quo, there's going to be a cost to this community of being engaged in this way. So starting in small ways, and I think it's another thing that Tiffany kind of touched on in her talk was that, to start small means bringing some people in, developing some relationships on a modest scale, and getting that, and then allowing these intermediaries to really, I talked a little bit about intermediaries in my talk, that bringing people in to help a hospital understand what's actually going on in the community is critically important. And that's I think, something that medical systems don't do enough and can do a lot more to begin to listen. That's the first thing. First relationships built by listening.
So to tie, Amy, did you have something?
I was just going to
Yeah.
echo both of your thoughts and saying that listening to the end users and to your partners and creating those strong partnerships and it is, I think, what's really key, and particularly for our line of work where we do projects in many different types of communities and many different types of contexts. I think we believe really firmly in not the kind of parachute model of coming in as an outsider and implanting an idea that may or may not belong there, but trying to let people come to us to ask us for help and developing really strong partnerships with the people who are already kind of entrenched and grounded in a place and letting them kind of guide us through the process and making sure that we're keeping our eyes and ears open and listening to what people are asking for and what people want while setting expectations for what can be done and what our role is as well. And I think managing those relationships throughout and showing that your role is to ultimately optimize and amplify the mission of the organizations that you're working with and not kind of towards your own end needs is really important one.
You mean their needs before your needs, is that right?
Yeah.
Huh. So to tie it all together, that when we enter a place to help, that we not only enter their space, but we enter their place. I mean, in fact, seek to understand first, then to be understood. Seek to listen more than you talk. These are themes that we heard a little bit yesterday, basically, for you guys who weren't here. That humility is actually important if you're actually going to find trust and form relationships in order to be able to get small things done first, but then larger things after that. Yes? Mm-hmm. No?
Yes, and one of the, on a language piece,
Yes,
I don't tell people that I'm coming to help. Because if you tell me you're coming to help me, I generally say, I got this. That's just me. I have it. I say I'm coming to serve. You want to serve with me? Fantastic. Saying to people that you are going to serve them is even just a small change in language and how people will receive you at times. I'm here to serve and support because there is this piece to me sometimes that privileged people have and that they feel as though they want to do great service by helping the underserved. And sometimes it doesn't feel dignified and it doesn't feel good. And so being very thoughtful about your language, while at times if I'm speaking to Stuart, I may say, hey, I need your help with something, or I need your help with something, and I don't think they would be offended, or I necessarily would be offended. But if I'm in an underserved community, people who are suspicious by nature of systems that have not treated them well or have not been welcoming or just haven't seen them, then even my language and my approach is adjusted. And so keeping that in mind as well, but everything you said was so right on point. And the speaker that I didn't hear yesterday, but apparently he introduced us quite well with his comments yesterday of seeking first to serve and listening more than you talk. I mean, all of those are just themes that I think you can hear throughout all of our pieces.
Yeah, it is, and it actually is striking among the three speakers how much that is a common theme. All right, I wish I had all day, but I'm actually going to get to some of the individual questions, and I will not get to all of these. I'm going to turn to you. Basically, let me segue from the discussion that we've just had in terms of going with some humility and some service to you, Stuart, because you talked a little bit about hubs. I mean, structurally, from the kind of policy standpoint, it seems like, well, it should be natural that if we're actually going to try to coordinate these activities and they're actually going to affect multiple different sectors, eventually somebody's actually going to have to say, I own that and I'm leading this thing. So we're still good. The theory's still pretty good. But then when the hospital raises their hand to say, and we'll take care of that, suddenly, again, all those red flags that you talked about, okay, so what you're telling me is the answer to our problems is a bigger hospital. Is that what you just said? I mean, now you have a social service department and a nutrition department and a transportation department. I mean, what do you say to the people who say that, that a hospital as a hub may not be the best idea?
Well, the first thing is to think about those institutions in the community that have a big physical presence and are involved in the community general. That's why I think, and I've done a lot of work looking at schools and the kind of thing that Tiffany is saying, it makes a lot of sense for a school to be a hub. It's a little trickier thinking about a hospital, but a hospital has lots of resources, so it's in principle should be able to do this. And then you're absolutely right. The issue is, how do you think about this in the long term? I think bearing in mind that chart I showed you at the very beginning about how much we spend on healthcare as opposed to social services, and if we were to change that in the future, ultimately, we would want hospitals to do a lot less of the fixing bodies and repair shop, and actually be a place where other services are available. And as we think of healthcare, one of the big problems we have in this country is transitions in healthcare. When you leave the hospital and go outside, things start to go wrong with lots of people, right? I mean, this is so. Hospitals should think of themselves not as one-stop shopping for everything, but as really valuable partners to different people. The hospitals I've seen that have been successful in this have been ones that have formed very important and powerful partnerships with either schools or communities or churches and so on. That's the way to think about it. To think about it as it's a hub that is the form of hub that acts as a partner, a linkage with others around it. Think of it in that way, rather than a place where everything happens in that community. That's, I think, an important distinction between schools as a hub, whereas you've heard Tiffany fixes, broken bones, and so on. And I'm not suggesting that hospitals should, open schools in the buildings, anything like that. But having that relationship is what's so critical.
But and that is terrific, Stuart. But I as a hospital have this muscle memory, which is basically,
unfortunately so.
Yeah, which is basically, if I want to accomplish something, I actually internalize it. And some people would say that I would take it over, but I actually have very good intentions here. And so, how do I actually get over that? I mean, because see, the thing that you talked about was really great. I get the theory on that, but the problem with that is that you're asking me to cede control. Now,
That's
control
correct.
something I really, really, really like as the CEO and CFO of this place. Okay. How, and there are a bunch of questions actually in the stack for you about exactly that. Okay, so we get it, right? The numbers are upside down. We should be spending more on social services, less on rescue care. But, the guy over there in the hospital's got the money. So what kind of transformation, what are we going to say to that CEO or CFO to convince them that, listen, the public good really will be served a lot better if you don't try to actually, take this stuff over, and if in fact you partner with people who are already better at this than you are.
We want the CFO ultimately to be willing to have some of the revenue that he or she gets go to somebody else in order to improve health.
Yeah, but my control thing is
not so
kind
easy,
of an
right?
issue.
No, that's true.
Yeah.
But I think desire for control emanates from lots of reasons. One of them is you're not familiar with what the capacity. Look, if one of Tiffany's schools was next door to a hospital here, or in this area, and you could see every day what goes on, even if you were the CFO, you'd start to think a little differently about what could happen, what would be a good partnership there.
Yeah.
I mean, I'm sure Tiffany's very good. I'm sure you're very good at figuring out how to get money for what you want to do. But that said, as you emphasize, much of what you're doing is based on volunteers from within the school community, and that's good. But you've got to sort of, by building that relationship and understanding, I think part of the sense of control starts to, you feel less concerned about conceding control if you trust the other people to be effective. And that's why what I said earlier about building up the case of what goes on in other parts of the community, drawing on the university to show effectiveness, is partly to help the hospital system to concede control in that area.
So part of the critical task that I just heard you say is that this is not only about the community trusting the hospital, this is about the hospital trusting the community.
Absolutely. And because if you think the best way to deliver health care is to go to medical school and do this for dozens of years, how can somebody from a school know more than I do? Well, they don't know more about certain things, but they know a lot more about the dynamics of communities than you're likely to do if your experience has been medical school and trauma surgery and then,
it wasn't
running a
that
hospital,
great, actually, yeah.
whatever it was, yeah.
So Tiffany, you had something on that?
Can I give an example?
Yes,
And if I
ma'am.
speak off turn and this doesn't capture it, let me know. So to give you some practical resources, and my husband's an OBGYN and a robotic surgeon. I always tell him, baby, you bring him in the world and I got it from there. So we got this thing, birth through college. We got
Somebody
this
tweet
thing.
that.
Okay. And then he spends a day at Swope. So in Kansas, there's a Swope clinic, and they have a huge area of not just the clinic that feeds to the hospital. He works at Research Medical Hospital, but a grocery store and all these other things that have been created. It is really absolutely beautiful. Grace Med, that's another example. See, models of success, it's no different than schools. If you see models of hospitals doing what Stuart just described, then you know what's possible. And you know you're choosing not to do it because you're choosing not to do it. Grace Med is another example. We are partnering with them to build a clinic in an area that has no clinic in Topeka, Kansas, near two of our schools, State Street and Chase. They'll now have a clinic in January 2016 as a result of Grace Med partnering through writing a grant. Through the Affordable Care Act, Grace Med has like tons of clinics in Wichita already. Someone from the Kansas Health Foundation approached me right after this and said, we actually are helping fund some of Pine Ridge, and one of your school board members just joined our board. I mean, so it is this piece of building relationships and showing models of success in terms of possibility. That's how you change minds, because this is a mindset thing. This is changing how you think. And then if nothing else works, take it back to the dollar. It really is about, if you don't invest now, you're going to be paying for it later, and I'll show you how you're paying for it now. So the emergency room is the health care for some of these folks who aren't getting health care. So if all of the other pieces don't work, it's very, very easy to correlate cost savings and dollars for the investor that wants to have greater profits for their hospital. And Stuart mentioned that I'm so good about getting money. I don't know about that. So anybody that wants to donate to Topeka Public Schools, you write Topeka Public Schools. You should say, I'm going to give her $5. I'm going to send it to the district. But it is this collective responsibility that we have with hospitals as well as the community.
So you guys have managed to convince me that maybe the hospital thing isn't such a great idea. What would you say, Tiffany, about the education system being the hub? I mean, it's not,
education systems are the hub. Everybody has to send their child to school. It is the center of the community. And anybody in a school system, shame on them if they're not creating community agencies within the school in creative ways. In fact, one of the school buildings that will be empty as a result of some schools combining this year, we actually will be utilizing that building to create a community hub. And so my third or fourth meeting in Topeka, when I finished the Mission and United Way in the universities, was with Harvesters, the food bank. So they're opening up a mobile food bank in August for us. All this, and I only been there 3 weeks, you guys, so excited. But these people were already there doing some of it in small ways, ready to grow it in larger ways. And so that particular place, they're willing to be a community hub. So we literally will take a building, and all of the clinics and all the other agencies that want a space in that building, we already have one in Topeka prior to me coming, so we'll be building on that. Schools are the center of the community. Everybody has to send their child to school. So I do believe that is a hub in and of itself.
So in that model, would you be then responsible for the health of the community? I'm not saying it's a bad idea. I just think it's not traditionally the way I think about this.
Oh, absolutely.
The school district should be the person that people come to say, listen, we still have unacceptable readmission rates or that kind of thing.
Absolutely. It's a shared responsibility. John Dunn from the Bell Tolls, he says, you can't do well unless I do well, and I can't do well unless you do well. It's a shared responsibility in making sure that we know that we are truly connected in this real way. So yes, schools share the responsibility of being responsible for health and wellness and trauma and mental health. As I've left Jennings, in Jennings right now, there are not only counselors, but mental health therapists, 2 to 3 at every school. We have a family kind of advocate that does home visits, 2 absences, and you get a home visit. That's what support looks like. So we'll be building that kind of support. How we'll redirect dollars in Kansas, which has a difficult financial structure, we have to figure it out. So I don't know how we'll do it, but I'm counting on them and I'm counting on y'all to help kind of look at how we make this stuff happen.
I love the done reference, which I think begins, no man is an island, and ends with, ask, so when you hear the bell toll in the village, ask not for whom the bell tolls, the bell tolls for thee.
Yes.
All right. So to follow up on that, we have a few more questions for you, Tiffany. What do you think urban school districts should stop doing, and what do you think school districts should start doing? I mean, anybody who's a manager out in the audience knows that if you just keep adding and adding and adding, that eventually you just burn your people out and stuff starts to fall off the back of the truck. As you look at probably not the structure of your school district, but the traditional school district, what should school districts stop doing, and what should they start doing in order to be able to achieve their goals?
Well, this answers for school districts and your organization, no matter who you work for. I put the 3 items up there: relationships, curriculum, and pedagogy. If you're not in education, you can take curriculum and pedagogy in terms of just job curriculum, and pedagogy are the employees and if they know what they're supposed to be doing and are they skillful. But relationships is number 1. So all schools need to make sure that they are investing in creating relationships. And I think all 3 of us have talked about that in unique and creative ways, thinking out of the box. And so anything that you are doing that is creating systematic problems and preventing access and opportunity, you need to stop doing. Anything that is creating problems with building relationships, you need to stop doing. And y'all know I'm a storyteller. I'm going to talk fast, so I'm going to tell this story real fast. So because, you know, I'm a teacher. You call me superintendent, I'm a teacher. My classroom just looks different. Here's a quick story on that piece of what you stop doing. So we border Ferguson. And so Mike Brown, you know, he died not too far from our school. His family goes to our school district. Everybody's walking out of schools across the nation. We're 100% black. They said, Dr. Anderson, we have to walk out. You know, they're calling us punks and everything on Facebook because we didn't walk out. We got to walk out. I said, okay, where are we going, y'all? He said, well, I said, okay, you know what? I tell you what. And so then they all came out, and they were going, no justice, no peace. So I stood on a chair, no justice, no peace. They said, oh, my God, no justice, no peace. So they all gathered around. I said, here's what I want you to do. Tomorrow, come back. I want to know what 3 things do you want from your community. Come back with the 3 things. That's the morning work. If you come back with those 3 things, we're going to pile it up. We're going to get it down to the 3 things. And then the next day, anybody that tells you to walk out of school isn't in for your best interest, because that's the only way you're going to get power. So you need to stay in school so you can get your power. So with that in mind, 6 a.m., because we're not going to miss school. I'm going to have a bus up here. You meet me up here. We're going to take the bus halfway. Wear your suits, because it's a business meeting, y'all. And we're going to take the bus up. We're going to get off halfway. We're going to march the rest of the way. And I'll make the signs so we make sure everything's spelled right, looks good. All right. They said, Dr. Anderson, they're going to fire you. I said, well, y'all better show up. So they showed up. So you had helicopters and all these news stations seeing lines of kids. The police department, the 3 things ended up being community policing. They wanted minorities on the police force in Jennings, and then they wanted body cameras. That's not a bad list. And the police department agreed to all of them. So what do we need to stop doing? Stop with these messed up relationships. Reach across the aisle, which we did. The police department agreed with us. And now we have, you know, the Teen Police Academy. We have an African-American police chief. We have the first African-American SRO. They made that happen. So Dr. Anderson didn't do anything but point you in the right direction and get you to think about things a little differently. But so what do you need to stop doing? Stop these messed up systems and stop doing things that hurt relationships and start building the relationships and creating systematic change.
Excellent. Okay. This one is for all 3 of you, and we can start anywhere. Of all the challenges you've encountered in your work, all the barriers, and Stuart, you talked a little bit about this in your talk, technical problems, data, operations, culture, relationships, other things. Of all the challenges you've encountered in your work, which was the most challenging?
I see 2 levels of challenge.
Okay.
The biggest initial challenge I think that organizations face, or when they try to do this kind of work, you know, is often just not knowing. It's just being literally ignorant. I mean, just not having that basic sort of knowledge, including the data and this kind of thing. When you get further down the road and start saying, how can we do this at a scale? The big problem in terms of particularly the health system is payment systems, budgets. If you can't move money from one pot to another, So in other words, you've got a big problem.
Yeah.
And that's ultimately where you really see problems. I think there's solutions to that, as I said. I think that we can see ways in which local government and county government can reorganize itself a little bit. There are a whole number, and I'm not sure if this is true in Colorado, but a whole number of states have what they call children's cabinets. I don't know if you have that here, where the agency heads that deal with children in some way at the state level actually get together and talk about how can we reinforce each other. Yeah. We may have all budget restrictions, but let's see if we can figure out how to spend our budget like we were doing it on purpose to kind of connect together. I think that's important. I think I mentioned that a number of nonprofit hospitals now, thanks to the Affordable Care Act, have to look at their community, have to look at what health is in their community, and they have to have a plan to help improve it. They're required to do that as a conditionality of nonprofit. Well, think about if Tiffany's situation, if you have a hospital that's open-minded about what does community involvement mean, you can talk about a significant amount of dollars that the hospital has to spend on the community now being done in creative ways. So I think it's, the big final barrier is this budgetary issue and the payment structure. It's money because otherwise Tiffany's not going to be able to do open heart surgery until she gets money, right? You've got to be able to expand the activities. Right. I'm only joking about that, but you need to expand the activities, and there's always a kind of a limit when resources. There's always a budgetary limit, and that's what sort of holds back, I think, so many organizations.
Amy, you worked in some of the world's most challenging conditions. What was your biggest challenge so far?
I think maybe I'll talk quickly about two. So one is that we face a constant pressure to get things done as fast as possible, as cheaply as possible. And I think, it's a pressure that we feel is very real because of the great need and the great timeliness of a lot of the interventions that need to go on. But I think we often feel like it's the wrong metric, and we often need to kind of fight an uphill battle to convince our partners that doing the bare minimum and doing it as fast as we can isn't going to achieve the long-term outcomes that they want.
So they want fast, they want cheap, they want basically easiest route possible, or?
Yeah, and I think that it's totally understandable why you want fast and cheap, but if you step back and you look at things systemically, or you look at the building even if in its lifespan, you understand that doing the bare minimum is actually pretty cost ineffective at times. We've seen hospitals where they kind of slapped it together and the OR was built with 7-foot high ceilings and it was unusable, and they in fact wasted tons of money. Or you see cases in which you build things like maternity waiting homes without thinking about how people will be using them or why they'll be using them, and they don't achieve the use that you're really imagining.
Okay.
And then I think another thing that we really face is not having the evidence to adequately convince people why quality matters and what this larger understanding of value is. And I think that's one thing that we're really working on now, and we'll be continuing to work on. And it's difficult in domains like healthcare and architecture, where there are so many kind of complex and confounding factors to really isolate and be able to pinpoint doing this one thing created this value and created this change in a certain way. But it's really necessary for us to be able to represent that, to be able to explain to people why doing things differently matters and what it can change. And I think we're trying to explore that in a variety of ways, from quantitative to qualitative.
Yeah, I was going to go there as a follow-up because I was starting to hear creeping in. Are you talking about more studies or stories or both, or what do you need in terms of more evidence that the stuff that you're doing actually creates value for people?
I think it really ranges. Sometimes storytelling and capturing individual people's life changes is really an important way to show things like the video.
Yeah.
I think for other audiences, particularly funding audiences, being able to point to data and to metrics and to hard metrics is really key, and it's really difficult. But I think in the whole design process, we try to think creatively about how we can embed those opportunities. So for instance, in the maternity waiting homes example, being able to compare to the standard prototypical health facility for a series of schools that we're working in Rwanda, where the goal is to rethink how we can design the interiors of classrooms, but also the school as a whole to create better learning environments and hence better outcomes. We're doing a range of qualitative evaluations comparing the before to the after situations to show what the improved school setting has really done. So we're really trying to think about those opportunities for evaluation from the beginning.
So I hear both, basically, that basically depending on the audience, you may want the story, you may want quantitative data, but that basically, depending on who you're talking to, you need different kinds of, for lack of a better word, evidence that this all works. Okay. Tiffany, your biggest deal.
Mindsets and resources.
Yes. Can you say more about that? Because we've talked about mindsets a lot here today, but it also tends to be the most elusive, basically, for people trying to make big change out in their communities. Say a little bit more about mindsets. Stuart already talked about money, about resources.
Right.
Say more about mindsets.
Well, and on the resource end for us, it's flexibility with the dollars, so that kind of goes with Stuart. So a lot of the funds are tied to certain utilizations that so certain things you can't do. And then if you want to make change and make it sustainable, again, when you're talking about resources, you don't want a lot of the changes on grant funding exclusively. The mindsets really is, I think it's a challenge perhaps for all of us. How do you change mindsets, which would allow the person to see the value in what Amy is doing, to be able to see that, or which would allow the hospital to understand how best to connect. And certainly when you have people that have been doing something a certain way for a long time, it's difficult to show why there's another way and another path that might work.
Well, we talked about this in the setup call, that this was going to go really fast, and it actually has. So we're down to the last words in lightning round, and basically for anybody going back to 150 emails on Monday morning, in which they were inspired by what they heard today, but they actually want to do something on Monday to try to chip away a little bit at the gigantic problems that we've defined that are all interrelated, what would you tell them? Stuart?
Well, I think in just in a few seconds, the first thing is to think that maybe the solutions, particularly in the health, if you're in the healthcare business, maybe some other people can bring part of that solution. Maybe it is, maybe you should pick up the phone or send an email to the local school principal, or to make an appointment with the person who runs the local housing authority, and so on, and start to just open your mind up a little bit more by actually face-to-face conversation about what may be possible in the future.
Awesome. Tiffany?
I think when you leave here, don't just leave and go back and say, that was good, I feel pumped up, but do something. That's the first thing that you say, I'm going to do something, and I'm going to do something different. And then know that you are the solution. That is why you are privileged to be in the spot that you're in. It's not by mistake. So when you go back, you say, what is the something that I'm going to do now that I understand I'm the solution, and how will I connect the dots? And then as needed, reach out to me. After you say, how can I connect with places beyond the spot that I'm in? This isn't about your area. It is about how we all improve health and wellness for all communities.
And Amy?
I would just add on to what you were saying by saying that I think the biggest thing that we individually can do is not to be inhibited by what we think our roles are or what we think our jobs entail, and that by listening and kind of keeping our minds open, we can discover and come across ideas like integrating laundromats into schools, which isn't something that you might think of off the bat, but by kind of keeping your ears open and listening to people and challenging the idea of, well, why not? I think that we can really do things differently and do things that after the fact seem a little bit obvious.
Well, we could do this for another 2 days, I think, and I would be fascinated for that entire time, but I'm also cognizant that I am the last voice between you and lunch at this point. If you would indulge me again for one more moment, please help me in thanking these people.